All right, y'all, it is 12:03, so we will go ahead and get started. Thank you so much for joining us today for a conversation about PFAS in Florida's waterways. Just some housekeeping things again. Please keep yourself muted throughout the call and keep your camera off so that we don't distract from any of our panelists today. And as you have questions coming up throughout the call, please stick them in the chat as we go. We'll be keeping an eye on those, and at the very end of the call, we will get to those questions. And then there will be a recording of this that will go up on our YouTube and on our website. And I will be sending an email out, most likely tomorrow, to all of you with that and the contact information of every speaker on this call as well, so that you can follow up with him. But first, we are going to start with a brief presentation from Niyati Shah about PFAS in Florida's waterways, just kind of the overview there. And then we'll switch to a panel of experts to answer some specific questions there. And then we'll go to questions from the audience. So first, I want to introduce Niyati. Niyati Shah is the Headwaters Watershed Specialist for St. John's Riverkeeper. After receiving dual bachelor's degrees in public health and statistics, Niyati worked as a research analyst evaluating and monitoring social safety net programs and healthcare initiatives at Insight Policy Research and Westat. As a Fulbright scholar in India, Niyati researched the intersections of climate change, migration, gender, and health in Bengaluru's informal settlements. She is excited to defend riverine and riparian ecosystems, expand monitoring efforts, and build grassroots coalition in service of the St. John's upper and middle basins now and for years to come. Hey, Niyati, thanks for being here.
Thanks for the lovely intro. Good afternoon, everyone, and thank you for joining us. As Darden said, I'm Navy, the Headwaters and Middle Basin Watershed Specialist at St. John's Riverkeeper. Our mission is to protect and restore the St. John's through science, advocacy, and community engagement so future generations inherit a clean and healthy river. So today we'll be talking about PFAS, what they are, how they enter Florida's waters, the health risks they pose, the regulatory landscape, their connections to sewage sludge, and ongoing research efforts led by the experts on our panel today. After a brief intro, we'll hear from the three leading Florida researchers, Dr. John Bowden, Dr. Abbey Tyrna, and Dr. Lauren Kleiman. PFAS are per- and polyfluoroalkyl substances. They're a group of more than 15,000 chemicals, synthetic chemicals used since the 1940s in products such as nonstick cookware, waterproof fabrics, food packaging, and firefighting foam, among other industrial and consumer products. Because they resist heat, oil, and water and do not readily break down, they accumulate in our waters, soils, wildlife, and bodies, earning the name forever chemicals. How do PFAS get into Florida's water? So PFAS enter the environment through many different pathways, and these are just a handful. Industrial discharges, firefighting foams used at military bases and airports, landfill leachate, wastewater treatment plants, and sewage sludge, just to name a few. Wastewater treatment facilities cannot remove PFAS as a result. These chemicals leave plants in two ways, through treated wastewater discharge to rivers and lakes, and through biosolids, which are sewage sludge, often applied to farmland as fertilizer. Because PFAS can bind to organic matter, sewage sludge dumping can contaminate soils, groundwater, and nearby waterways through runoff and leaching. And we'll get into that later. But why does this matter? Exposure to certain PFAS has been associated with increased cholesterol, immune suppression, thyroid and liver diseases, developmental impacts, reduced fertility, and higher risks of kidney and testicular cancers. For instance, breast milk from mothers with PFAS in their blood, along with formula made with water containing PFAS, can expose infants to the forever chemical. And because PFAS remains in the body for years, even low levels of repeated exposure through drinking water, food, or contaminated products can accumulate over time. Exposure can also occur through certain occupations, such as firefighting or chemical manufacturing, drinking water, as mentioned before, contaminated foods such as fish, and using products containing PFAS. Although researchers continue studying thousands of PFAS chemical compounds, the evidence surrounding chemicals like PFOA and PFOS has been strong enough for health agencies worldwide to recommend minimizing exposure whenever possible. PFAS in Florida today. So PFAS contamination has been documented across Florida in surface water, groundwater, coastal ecosystems, and wildlife. And our panelists will go into how and where and to whom. One of the most comprehensive statewide studies, led by Dr. Bowden and colleagues at UF, detected PFAS in 63% of spring events sampled across the state. Green, Blue, and Gemini Springs held the highest concentrations. And in another study, they found PFAS in exceedance of the EPA limit in 23 out of 67 counties where they sampled for surface water, with high levels found in Pinellas, Hillsborough, Miami-Dade, Brevard, and Alachua. Brevard is located in the upper basin of the St. Johns River. They found that raw sewage spills and untreated wastewater spills could potentially be significant point sources for PFAS across the state of Florida. Later on in the panel discussion, we'll hear more about the implications of this work. So this is a little bit about the regulatory landscape of PFAS. In 2024, the EPA established the first national drinking water standards for several PFAS compounds, including a limit of 4 parts per trillion for PFOA and PFOS. While recent legislation has mandated Florida's public water systems to conduct quarterly PFAS testing, Florida itself has not adapted its own state PFAS drinking water standards and currently relies on federal regulations. More recently, the EPA proposed extending the compliance deadline for public water systems from 2029 to 2031, and they also rolled back certain limits for certain PFAS. Environmental groups like our very own Waterkeeper Alliance have filed public comments arguing that delaying implementation and rolling back limits could prolong exposure for communities and weaken public health protections against the forever chemicals. Several states have already taken strong action and led the front on PFAS legislation, including Maine, Connecticut, Michigan, Washington, and New Hampshire, just to name a few, through bans, limits based on certain thresholds, and requiring testing before dumping. Safer States is a website that talks about different PFAS legislation that's related to biosolids and other sort of industrial and consumer products, and that you should totally check out after this webinar. So, like I said, wastewater treatment does not remove PFAS. Contemporary wastewater treatment plants do not remove PFAS from sewage sludge. As such, they can become a pathway for contamination of soils, groundwater, and nearby rivers. So for nearly 2 decades, more than 70,000 tons of sewage sludge on average has been annually permitted to be dumped on within the upper basin of the St. Johns River, which includes, like we said, Brevard, Indian River, and Osceola counties. Nationally, Waterkeeper Alliance found elevated PFAS at 80% of sites downstream from biosolid application areas, underscoring the potential for these chemicals to move into waterways and its sort of inextricable linkages between biosolids and PFAS. So to better understand whether this is occurring in our watershed, St. John's Riverkeeper has launched a study examining PFAS in waters associated with biosolid application sites near Melbourne. The city of Melbourne gets its drinking water from Lake Washington, which has experienced significant nutrient loading from biosolids further upstream, which, as we know, are a proven source of PFAS. Our goal is then to generate local data that can inform advocacy, guide future research, and help protect the St. John's and the community that depends on it. So if you, a family member or a friend, live in the Melbourne area, do sign up for this study using this QR code. We'll get you a test kit. I'll walk you through how to sample your tap water, and we will discuss the results together. PFAS are one of the most defining water quality challenges of our time. So, and addressing them will require continued scientific research, strong monitoring, thoughtful policy, and collaboration among researchers, utilities, regulators, and communities, and friends of the St. John's Riverkeeper like yourselves. With that, I'd like to welcome today's panelists and punt it over to Dryden.
Thank you so much, Niyati, for all of that great information and an intro into this issue. We're going to go ahead and go on with our panelist discussion, and I'm going to first introduce each panelist to you today. So first we have Dr. John Bowden. He's an associate professor in the Department of Physiological Sciences at the University of Florida College of Veterinary Medicine. His research focuses on environmental chemistry and toxicology, using advanced mass spectrometry to study the life cycle of emerging contaminants such as PFAS, as well as their effects on human health, wildlife, and ecosystems. He has helmed some of the most significant PFAS work in Florida by helping improve the detection, monitoring, and understanding of PFAS contamination in water and the environment. He has 160 scientific publications and over 70 of them pertaining to PFAS. Thank you so much for being here today, Dr. Bowden.
Thank you. Pleasure to be here.
Next up, we have Dr. Abbey Tyrna. She's the executive director of Suncoast Waterkeeper, an organization dedicated to protecting and restoring Florida's Suncoast waters through monitoring, advocacy, and legal action. She holds a PhD in geography from Pennsylvania State University, where she studied the impacts of development on wetlands and previously served as the water resources agent for the University of Florida's IFAS extension in Sarasota County. She launched the Forever Free program in Northport, Florida, a community initiative that provides PFAS education, free drinking water testing, and resources to help residents reduce exposure to forever chemicals. Hey, Dr. Tyrna, thanks for being here.
Thanks for having me.
And last but not least, we have Dr. Lauren Kleiman. She is a research associate at the Ocean Research and Conservation Association, also known as ORCA, in Vero Beach, Florida, where she leads the organization's ecotoxicity program. She earned her PhD in integrative biology, environmental science from Florida Atlantic University, and now works on mapping pollution, identifying contaminant sources, including PFAS and other emerging pollutants, and is using data to guide restoration and conservation efforts in the Indian River Lagoon. Her research helps communities and policymakers better understand the water quality issues faced by our waterways, the wildlife, and the humans that rely on them. Thank you so much for being here, Dr. Kleiman.
Thank you.
Wonderful. Thank you all so much for being here. We're going to start first with Dr. Bowden. Your Florida Surface Water Project provides one of the most comprehensive statewide snapshots of emerging contaminants in Florida's waterways, while also engaging students and the public in environmental research. Can you tell us a little bit about why we should be so concerned about PFAS and what are some things that you think the general public should know about this issue?
Yeah, so I'll try to keep this relatively brief because I probably could talk about this for hours. Yeah, so when I first got into measuring PFAS or looking at PFAS in the state of Florida about 10 years ago, I realized that even though I've been using these chemicals for over 90 years, around 90 years, we knew very little about them. We knew very little about where they are in Florida, where are the hotspots, areas we should be concerned with. And really, if you're going to have any discussion with regulators, politicians, you need to have it with supporting data. So this study that we did starting, well, about 6 years ago, we went out to try to get as many surface water samples as we could across the state of Florida to test. And we started with students. So we tried to work with local UF students to try to educate them on water quality and how to collect samples. And actually happened during COVID. So a lot of those students were actually home across the state. And then it kind of sparked into this idea that maybe we could look at more than just around Gainesville. We could try to get the whole state of Florida. And then we got connected with water keepers and local citizen scientists and other people who heard about the study and ended up being over 2,300 sites we sampled in the state of Florida. So what was really great about it was that we got this great data. We have these heat maps. We now know where the areas are that are of concern. But we also got to connect with a lot of community members. And what I learned was that people didn't know much about PFAS. And I think there's somebody else got their thing on. Anyway, so people didn't really know much about PFAS. And so part of the challenge with this is to educate people for a few reasons. One, because people educated will make smarter decisions in their lifestyle and behavior, so they'll be able to start to remove maybe some of the exposures. They can have educated discussions with their politicians or local representatives to talk about why this is important to them and why they should start focusing on regulation. But also it's for self-awareness too. You mentioned that wastewater treatment plants discharge PFAS and there's landfills that have PFAS and biosolids of PFAS, but ultimately we're the ones responsible for this issue, right? PFAS were created because we were tired of oil leaking through our food packaging, and we didn't like our stains on our clothes, and all these things that we told the chemists to go back to the lab, make these chemicals, make our products last longer and cheaper. That's why we're in the situation, right? And that's just a microcosm of the entire situation. But I think we also have to be cognizant of our role in this, and that the people who operate the wastewater treatment plants and landfills, they're passive receivers of our waste, our PFAS laden products. So I think educating people of what PFAS are, the life cycle of PFAS, how they eventually end up back into our waterways and in wildlife, I think in our drinking water is important that we understand the whole cycle. But I think moving forward, getting legislators, politicians more focused on being proactive, I think is important. Right now, we're kind of going backwards a little bit with some of the progress we've made trying to regulate some of these PFAS. I don't think it's a bad thing to regulate PFAS in our drinking water. I think we should all have safe drinking water. And there's 15,000 upwards to a million classified PFAS. So, and we're only talking about regulating only like less than five. So, I think there's a lot of discussion needs to be focused on that space because, as you may or may not know, a lot of the PFAS that we talk about most often are what we call legacy PFAS, the ones that have been around for a long time, for like PFOA and PFOS. And as we phase those out, new ones are being created and being used, and we know very little about those. And so I think we need to, at some point, be a little bit more ahead of the curve than we are now. But it's a challenge without help from our local and state and federal governments.
Yeah, great. Thank you so much. I want to focus in a little bit more on drinking water, and I think the folks on this call would be especially interested in your Florida Spring study. So, what implications does the spring study have for Florida's groundwater, where we derive much of our drinking water?
Yeah, so we had both the spring study and this statewide surface water project, and we spent 5 years working on the surface water project. But I think I get more questions asked about the spring um, project, and that was only like a summer project for a student. So I think that definitely exemplifies the awareness people have of the impact. I think it's easy to understand how surface water can be contaminated, right? You have runoff, you have discharge. I think it's a little harder to understand how a spring can be contaminated. And so I think that raises a little bit more of a level of concern with people. In terms of the impact, I think that study was more a warning signal, right? Like we should be doing more monitoring of the springs. And if we find stuff in the springs, where is it coming from, right? I think I don't really know if anybody's looked at springs since our study. And I think there's definitely more effort warranted to go back and try to understand, did we sample maybe during a time period when there's more people in the water swimming in the spring? I think there needs to be more data to be able to make more conclusions about the real over long-term impact of what we found. But I definitely think it got people's attention that, look, hey, like PFAS are very mobile. They're very successful at getting into a lot of different spaces. And unfortunately, once they get to those spaces, they're very difficult to get rid of. So I think anything we can do to try to monitor, but also prevent that from getting worse is important. That's where biosolids comes in too, right? We started putting biosolids on fields that PFAS is there for a really long time. So it's hard to take that away once you've contaminated it. So in terms of moving forward, I think we need to do more testing, more
Yeah.
monitoring. And I think the monitoring and testing that's been done, I think needs to be more transparent. There's people who are doing monitoring, like the water keepers, and they do a very good job. And Orca did a very good job of sharing that data with people, but there are a lot of testing that's going on that data doesn't see the light of day, and I think that shouldn't happen.
Yeah, for sure. Well, thank you so much, Dr. Bowden. I do want to remind folks on the call that you can put any questions that you have in the chat, and we will bring those to our panelists at the end of the call. So I want to shift over to you, Dr. Tyrna. Um, Your Forever Free initiative moves the PFAS conversation beyond research and by helping residents understand what's in their drinking water, offering testing, and using community-generated data to advocate for cleaner water and stronger protection. Can you tell us a little bit more about your study in Northport? What inspired this project? What went into the study? And what results did you find?
Yeah, thank you. So Dr. Bowden talked about two of his studies, but there's a third study that was done for crowdsourcing drinking water. And so one of his graduate students collected drinking water from across the state, and I was able to contribute 14 samples from the Suncoast. And out of those 14 samples, we looked at four different municipal water sources and then two private wells. So we did three samples for each municipal water source at different community parks and playgrounds, and then at two private wells. And what those results revealed is that the city of Northport actually had the highest on the Suncoast total PFAS concentration, but also when looking at the state mean, Northport surpassed the state mean as well. And so we wanted to learn, okay, well, was that like that was a snapshot, right? So that was just one time in one point in time. And so if we replicated that to the extent that we could using a private lab, would we get similar results? And so we got funding to do this work, and our goal was to get 50 samples. And right now we are sitting around, I think, 30 samples in Northport, but we've recently expanded it to other municipalities who get their drinking water from surface water. Because what we found in our area on the Suncoast, which is Manatee, Sarasota counties on the west coast of Florida, is that well water has no detectable levels of PFAS. And so when a municipality gets their drinking water source from the Floridan aquifer down here, we're not finding any detectable levels of PFAS. So we want to dig deeper into those municipalities that get surface water as their drinking source. And so we've expanded to the city of Bradenton, Manatee County, as well as Sarasota County. So that was the impetus behind the study. What our results show is that basically the city of Northport does have higher levels of PFAS than other municipalities that we're looking at, and but they don't have PFAS that replicate what is being potentially regulated in a few years by the US EPA. And so that's something that, we have to communicate and think strategically about that. When the federal regulations come down, there'll still be PFAS that are not regulated, and those are the PFAS that we're finding in the most abundant concentrations here on the Suncoast. And I think also that Dr. Bowden's graduate student Thomas also found like PFBS, for instance, at being pretty high levels compared to other PFAS, especially those that are going to be regulated as single independent PFAS. And we're also finding pretty high mixtures, we're finding around 20 to 30 parts per thousand on the high end. And so, I'm sorry, parts per trillion, PPT, parts per trillion. And so, that is concerning.
Thank you so much. And kind of following from there with this study, what have you learned about public awareness about PFAS in Florida communities? And how do you balance communicating the risks of PFAS without creating unnecessary alarm with people, especially when many people hear forever chemicals and they immediately worry about their family's health?
Yeah, so unfortunately, there's not been a lot of published research on the thousands of PFAS that you can find. So, there's a lot of research on two main PFAS, PFOA and PFOS, and that's really great, but I don't think that they are directly transferable to the other PFAS. So, like for instance, if we're finding PFBS at these levels of 4 to 5 parts per thousand, what does that mean? What does that mean for the individual? What does that mean for their health? What does that mean for the municipality? We don't really know what that means because there hasn't been any health goal that has been designed by the federal government or the state government in which we can utilize that health goal and say, to be healthy and consume, your daily intake of water, you should be only drinking, like for PFOA, it's 4 parts per trillion, right? We don't have that for a lot of the PFAS that we're finding. And so how we communicate that is just like, well, we know that PFAS stay around, they stick around. So what you're consuming today is going to stay in your body. And then if you're adding on top of that, that's not good overall. And so what can we do? So our goal is to be, as forever free of forever free chemicals as possible. And so, the best way to communicate is that your main source of contamination is through drinking water. And so the best thing you can do then is filter your water, right? So we also got a grant to provide filters that we know are third-party certified to remove PFOA and PFOS because that's the only third-party certification you can get at this point. And so we're hopeful then when they use these filters that they are eliminating other PFAS as well. And what we found through our studies is that all the PFAS that we're finding locally are below detection level once we use this filter. So that's some good news. So, protect yourself, reduce your risk as much as possible. That's what we're communicating. We don't have all the answers because the science is just not there yet.
Thank you so much, Dr. Tyrna, and thank you for all of your work you've been doing on this. I want to pivot over to you, Dr. Kleiman. Um, Orca's One Health program brings together human, animal, and environmental health to create a more complete understanding of toxins in Florida's waterways. Your One Health fish monitoring study examines fish as indicators of ecosystem health. What have fish revealed about the presence, movement, and potential impacts of toxins in Florida's waterways?
Thank you. So our One Health project, we have a lot of different initiatives at Orca. So we are doing pollution mapping and looking at the sediment in the water and all of these different parts that tie into One Health. But as part of that One Health program, we have this fisheries monitoring study where we're looking at many of the contaminants that can be found in fish, especially in the fillet, which some people, especially in Florida, consume. And especially there's certain communities that are reliant on fish, subsistence fishers, that consume more than the average person, and would therefore be more exposed to the PFAS in the fish fillet. So we did an initial sampling throughout some of our sites in the Indian River Lagoon, and then we had a more targeted study just focused on Martin County within the past 2 years that added another 150 fish. And across those 250 fish, we had, I believe, 6, definitely less than 10, that were had below detectable limits of PFAS. It is, like Dr. Tyrna was saying, really difficult to figure out how to communicate that to the public as for consumption, not drinking water. There is no guideline. There's some state level guidelines or advisory levels, but it really varies widely by state. And so then it's hard to tell the public what they should be looking for and where that kind of threshold is. But we are finding PFAS in almost all of the fish fillets that we've tested in the Indian River Lagoon.
Wow. And I know this might be a nuanced answer, but like, is there a specific fish that you're more worried about than others? It sounds like you found it in all of them.
So, although, so presence wise, we are finding it in almost all of the fish. That concentration and that dosage is definitely part of the story. And you will see higher concentrations as it does bioaccumulate, and you look at those higher trophic levels in the food web, so things that are higher level predators, because those PFAS aren't going away, just keep accumulating from all of those smaller sources.
Yeah.
In our study, especially in Martin County, as we had a wider sampling with that, we were seeing higher concentrations of PFAS in our freshwater fish as opposed to our saltwater fish that we were studying.
Cool. Thank you so much.
Can I add to that too?
Yeah.
Yeah, so just to add to that too, in some of the fish work we've been doing, those fish that are benthic that live at the bottom of the ocean or the water surface typically have extremely high concentrations as well. So PFAS like to accumulate in sediment, and they can accumulate in sediment in high quantities. And so those things that are sifting through, eating kind of close to the sediment, living near the sediment, typically have, in a lot of cases, as high as some of the predator fish. So I think catfish, flounder, things that are on the bottom of the ocean, bottom of the water, typically have high levels too. So I would be very cautious of those types of fish as well.
Yeah, that totally makes sense. Thank you. And then Dr. Kleiman, just continuing with you,
Yeah.
why is it important to study PFAS alongside other pollutants rather than in isolation?
So, as Dr. Turner was mentioning, we have these kind of two PFAS that everyone is more concerned about or are being more regulated, and there has been more research on. But there are all of these other PFAS compounds as well that are out there. And we're trying to look at as many of those as we can. We work with Dr. Bowden, some with that, to kind of expand that panel. And in addition to that, with our One Health project, we're looking at other contaminants, heavy metals, glyphosate, which is a chemical that's found in herbicide. We're looking at microsystems. So we're looking at other contaminants because there can be this cumulative effect of all of these different contaminants within the singular fish that you're eating. And with PFAS and all of the different compounds there, we don't necessarily know how some of them interact or can affect you when they are compound kind of mixtures of these PFAS.
Yeah. Thank you so much. It's always important to look at the big picture. I do have a few questions for our panel as a whole, so you guys can kind of chime in as we go, and then we will open it up to the questions from our audience. So again, please keep putting those questions in there. I know we've gotten a few already. Thank you for those, and we'll get to them in just a minute. So kind of for everyone, what are the next big questions you're hoping to answer regarding PFAS research heading over the next 5, 10 years?
Sorry, I hit the wrong button.
Mhm.
For us, we have a big project looking at compost and PFAS levels and different composting strategies coming out very soon. That's a US-wide project, although we do have quite a few composters from Florida in the study. And obviously, biosolids are a big part of that, but also food packaging that's supposedly compostable is not always compostable and safe by PFAS standards. So that's something that be happy to share once we're able to get that study out. But I think the biggest thing for us really is starting to do more biomonitoring. We are working with a lot of wildlife species right now that we are sampling and learning a lot about the effects of PFAS. But over the next 5 years, I hope to have done a lot more with human monitoring and actually measure PFAS in blood. So PFAS, unlike most contaminants that will accumulate in your fat tissue, PFAS actually bioaccumulate in your blood. So they bind to proteins in your blood. And so blood is actually a really easy matrix to actually test your levels. And we've developed a lot of new innovative technology that we can basically measure PFAS levels in a few drops of blood. So, and it's relatively inexpensive. So we're in the process now of trying to build out some studies, some ideas of communities to sample to try to understand, like if we're eating fish, we're living in water in these cities that have high levels of PFAS. Are those people more vulnerable? Are they more laden with PFAS than those in other areas? And how does that compare to the national levels? I think we need to understand. Yeah, it's really difficult to say if you have PFAS in you, what your biological or your disease-related impacts would be. But we could certainly describe whether or not our populations are higher or about the same as others across the United States, and I think that would be useful. Everybody in this call has PFAS in their blood. So, and Abby was talking about how we measure PFAS in water at parts per trillion levels. We have parts per billion levels in our blood. So that's a lot higher concentration. So I think it's important to establish that we are more vulnerable in the state of Florida because we have all these potential sources of PFAS. I think that data would then hopefully get our politicians in the state to be like, hey, we need to focus more attention on this
Yeah.
because citizens are being heavily impacted by it. So that's where I want to go the next 5 years.
Great. Thank you, Dr. Bowden. Dr. Kleiman, Dr. Turna, do you have anything to add, kind of what you're looking to learn more about in the near future?
Sure. So we are hoping to put in some proposals to look at more on that One Health side, connecting the PFAS in the fish and looking at osprey and how they might be taking up the PFAS that they're eating in the fish, especially because the PFAS levels that we're finding in the fish fillet, although we're not currently testing other parts of the fish, are likely much higher in things like the liver and organs that those other wildlife are going to be consuming, and then that's going to be taken up into their bodies. So that's one project that we're looking to do. Another project would be kind of expanding on this fish monitoring study that we did and looking at anglers and non-anglers, and especially communities that rely more on fish, and testing them for PFAS, testing the specific species of fish that they're eating and the specific area of fish that they're eating to kind of connect all of that more directly.
And I'd add that we are looking at, well, we're going to hit 100 tests in the next few weeks. And so looking at that data to understand where are the highest concentrations of PFAS in our municipal waters. And then also what we understand is that there's probably likely some seasonality to PFAS concentrations in our surface waters. And so understanding that seasonality so that we can get the full range of concentrations, I think is going to be really important. And so we are moving toward that as well. And then I'd also like to say that beyond like the science, we're also working with State Representative Connerly, who's passed a PFAS legislation, has worked diligently to pass PFAS legislation last legislative session, and is interested in doing more, which is really great. And so working with him to define what is more and what can we do. And while there's an appetite to do more, there's not an appetite to do it all. So finding
Yeah.
that balance is really important, and figuring out what is the best way to attack the sources. That's where his real interest lies, is attacking those sources.
Yeah, thank you so much. I do want to be able to get to our audience questions, but I have one more question for all of you, but please keep it brief if possible. Um, what role can community members, like people on this call, play in reducing PFAS pollution and holding policymakers accountable?
Yeah, I'd like to start. So one thing that we did is that we so when we did the City of Bradenton's drinking water source, for instance, we asked a representative or a city council woman to get her own water tested. Like be the leader that she wants to see in her community so that we can get her water tested, we can get her results alongside her constituents, because we're all in this together, right? And so I think that's really important. So Dr. Brown, I would recommend that when you do your blood study, go to those legislators first to see if they will sign up first to get their blood studied, so that we can have, strong leadership and also early buy-in on the solutions. And so I think that's really important.
That's a really good idea.
I'll just say that,
Oh,
sorry.
you go ahead.
I'll just say, like, yeah, obviously supporting local organizations like Waterkeepers and other citizen-based science organizations. I think, whether it be through sampling or through donations, trying to put more resources and dollars into these efforts. Hopefully, the state will eventually start doing that as well, and start putting more research dollars into universities and these organizations and local municipalities to start trying to move forward. But I think sampling or donating are two good ways of supporting a lot of this research. In addition to trying to curb any behavioral habits that might, include having PFAS, which is tough to do, admittedly.
Yeah, my answer is very similar to Dr. Bowden's. Orca is a nonprofit. So some of our grants come from science institutions and organizations, but a lot of it is also community foundations and private donations and the community. And we also have volunteers who we train to be citizen scientists who help us collect so much of our data. All of those fish were from our citizen scientists. So we would not be able to do the science that we are able to without those people, and more support is only going to help that keep moving forward.
Great. Thank you all so much for being here. We are going to answer some of the questions from the audience. I'm going to kick it back to Nia T, who has been monitoring our chat, and she'll have a few questions for you. And then after that, we'll wrap up. We have an upcoming event slide for you, and then we'll let you get on with the rest of your day. Back to you, Nia T.
Awesome. Thank you, panelists. Joseph asked, what is the cost per million gallons to remove PFAS and what are the most promising technologies? While I can't confidently answer the first question, I have a partial answer to the second question. And I think so in one of the things that the St. John's Riverkeeper is working on along with other environmental stakeholders is to explore biosolids processing facilities that will remove PFAS from biosolids and basically just remove the threat that biosolids pose to the watershed. And so one of these processing facilities is already in Indiantown. And it's it's two companies, Synagro and Varcor, have created this plant. And so we're trying to figure out other application sites where we could, as an alternative to the land dumping of sewage sludge and the land the landfill and also the landfill dumping of sewage sludge. These sort of facilities are really great alternatives to removing PFAS, alternatives to the land dumping, and also remove PFAS from biosolids. So that's one of the things that we have explored. Does anyone on the panel have more thoughts on promising technologies or cost?
I'll just say briefly that there are a lot of different flavors out there, like it's Baskin Robbins. There's a lot of different options, but most of them aren't to scale yet. So they're effective at the bench, but not actually to scale. But I just want to point out, so removing PFAS is one part of the problem, right? Because once you remove it, then where do you put it? And if you just put it back into a landfill, you're kind of just recycling this whole thing again. So it's removing, but also destruction are breaking down of the PFAS, which kind of go hand in hand with the actual management of PFAS. So I just want to point out, removing it is just diverging the problem to something else that eventually can become a problem later. So anyways.
And then the next question was, do wetlands that receive treated wastewater remove PFAS? Would anyone on the panel like to take a stab?
I know a little bit about this. So we published a little bit on this, and you have to remember PFAS are forever chemicals. So unless there's something with high energy or high power to break these things down, they're just going to move around. They're just going to sit there until they're shuttled somewhere else. So they may remove them by incorporating into plants or into sediment. But what happens when you have a big storm and you get that area flooded, or what happens when you want to use those plants for something? So I think it's important to remember that removing is one part of it. Then you have to deal with whatever you want to with what's left. And that's the challenge right now, is destroying PFAS. They're incredibly hard to destroy. So
I'm going to skip ahead to this question. What is the name of the water filter recommended and how to get one? Abby?
Yeah, so what we've been using due solely to cost and also because we are finding that when we use them, the concentration of PFAS goes below detection levels, is Culligan's 30 cup countertop filter. It is third-party certified, so it's NSF certified for PFOA and PFOS 99% removal. and like I said, we're finding that it's working well. One of our board members' favorite stories is that when Dr. Bowden's lab did that study on municipal drinking water, he submitted his water, which is filtered with reverse osmosis under the sink, and his was the only one that came back from his area as having no detectable levels of PFAS. So we do know that reverse osmosis is a good technology. It's just really important that you look into who's providing you that technology and whether or not there's also any components of that technology that might inadvertently introduce other sources of contamination. So it's important that you not only look into that, but follow the manufacturer's instructions as to when you have to change out the filters, et cetera, because that'll be extremely important.
There are also a lot of questions about fish and what adequate fish, like what the amount of marine fish consumption you recommend. Um, could you answer take a stab at that?
So Orca does not recommend anything regarding how much or how little you should eat. We are providing the information to make informed decisions, but we're not the right people to make any of those health guidelines for humans. Based on just our research, which again, a lot of that was very specific to Martin County. Those freshwater fish were much more elevated than the saltwater fish. It's likely that some of that comes from those areas where the freshwater is being much closer to a lot of where that contamination is going to be occurring. As for outer marine fish, we were just within Indian River Lagoon specifically, so all of ours were more estuarine fish. So we definitely can't speak to marine fish. We have been comparing our levels with the guideline from Europe that has a tolerable weekly intake consumption level for like a chronic, this is how much you're eating every week. Our average fish that we tested were still exceeding that level, but that does fall in line with other previous studies on Indian River Lagoon fish. So it's not super new and out there. I just think it's maybe not been as communicated with the public and available.
And I just want
So,
to,
yeah.
sorry, I'll just add that one of my graduate students is working on a project
Mhm.
looking at PFAS and saltwater fish. I think we have close to 3,000 mussel samples. And the goal of that project at the end is to establish through risk assessment what the levels that are safe for consumption are. So that's something we're working towards, but we don't have a lot of that information yet.
There was also a question about, does the bottled water that people drink in plastic bottles have more PFAS than filtered water from the tap?
Well, I do know that some of the bottled water that we did test and have tested has PFAS. Um, and I don't want to make any recommendations about which ones not to drink or not drink, but um, one thing I would suggest you do is when you buy bottled water, look at where it's sourced from. Some of them are sourced from springs, some of them are sourced from city municipalities. Where do they get their water from? So if you really want to know about whether or not your bottled water is safe, find out where it's from. And if you want to ask anything specifically offline here and email me, I can tell you more, but I just don't want to say too much on this call.
Yeah, and I would just add to that that we always recommend it's best for you to filter your own water. There's no reason why you need to get a third party to filter your water when you could do it for yourself and have better outcomes. So the Culligan 30 cup water filter that I mentioned is a glass filter. And so we are skipping the plastic for most part. And I think that's really important is to skip the plastic.
Great. Thank you so much to all of our panelists. Thank you so much for being here. I know we didn't get to everyone's question. I will send a follow-up email with the recording and with our panelists' contact information. So please feel free to reach out to them or to us with any other questions. Niti, would you mind going to the event slide that we have? Before I let you go, I just want to share with y'all a few upcoming events. Here's some key resources you can check out first. We'll send these in the email as well. And then some upcoming events that Riverkeeper has going on that we would love to see you at. Next slide. You can scan this QR code just to go to our general events page, which has all of these, but these are some events we have coming up in August. If you live in Jacksonville, tomorrow evening, we have our next Riverkeeper and Friends cruise. We'll have Gloria McNair from Groundwork Jacksonville there to speak about the Emerald Trail project and about the restoration of McCoy's and Hogan's Creek. And I have a typo there. It's actually at 5:30 p.m., but you can get your ticket for that on our website. We've got 2 kayak trips coming up in St. Johns County, our monthly McCoy's Creek cleanup coming up on Sunday, August 16th. We've got a really cool event later this month. It's called Literature in the St. Johns, and it's a conversation with local author Sarah Clark Stewart about her coming of age science fiction novel set in the St. Johns River. And then Niti will be helping lead a hike with the neighbors at Wekiva Springs later this month. And of course, we have our Riverview Park Service Day, which is a cleanup at Riverview Park here in Jacksonville. We would love to see you at any of these events. Please reach out if you have any questions and keep an eye on your inbox later this week for some follow-up from this call. Thank you so much for being here.
Thank you.
Bye-bye. Thank you.
Thanks for having me.
Thanks for organizing this.